good evening to all, the doctors, PG scholars, and the students. First of all, wishing you all a happy Mahashivratri. I, myself, Dr. S.R. Bharat Kumar, Organizing Secretary, welcome you all to the SHARE series, free webinar conducted by KHMA. Today with us, we have our President, Dr. Veerabrahmachari sir, our former Ayush Director, Dr. A.L. Patil sir, who are also joined in for this today's session. Now, I request Dr. Rajesh A., our Working President of KHMA, to welcome the gathering. Over to you, sir.
Thank you, Bharat. Welcome all for today's Shivratri special webinar hosted by KHMA. This is, I think, first of our festival experiment. I proudly welcome Dr. Madan sir for taking his time out of his busy schedule and always making himself available for our meetings. I welcome Dr. Veerabrahmachari. Welcome, sir. I also welcome Dr. A. Patil sir for this special meet. He is our former Director of Ayush Government of Karnataka. I also welcome Dr. Niranjan, our General Secretary, Karnataka Homoeopathic Medical Association. I think we also have Dr. Jayant, Vice President, KHMA. I also welcome all the other office bearers of Karnataka Homoeopathic Medical Association. And I also welcome all other students and our esteemed doctors who have always been supporting Karnataka Homoeopathic Medical Association. I once again welcome everybody. Over to you, Dr. Bharat.
Thank you, sir. Thank you very much. And now, to begin with, today's topic, Ailments and Management of Summer Effects by Dr. N Madan, the Senior Homeopath of Karnataka. As you all know, Dr. Madan sir, there is no requirement of any introduction to be given about him. So now I request Dr. Madan sir to take over and start the session. Yes, sir.
Hello.
Yes, sir. It is audible, sir. You can start.
Audible?
Yes, sir.
Oh. So first of all, one and all, happy Shivratri, and I thank the office bearer of KHMA for giving me a chance to share my experiences in this aspect of summer ailments. Now, after as the summer season starts, the first thing that we see is weakness, general weakness. That is why many times even students, they don't study during daytimes, but they prefer to study at night. One thing is it will be silent. Second one, there won't be much heat. In such cases, where there is severe tiredness, and particularly many times even the farmers working in the field, contractors, though building contractors, those who work in field, and the representatives, sales representatives, those who move about in hot sun, all such people, those who get tired due to the hot weather, their weakness will get cleared by selenium. If you study selenium in the Clark, you can see he writes as the condition becomes better with the sunset. So on that basis, we have seen by giving selenium to such people, and also such tiredness could be cleared by selenium. The other usual mistake done by the patients are they drink water or wash their face or take bath or sit under the fan soon after coming from outside. Here, we must advise the patients not to do these things soon after coming from outside, because if they sit under the fan, if they take cold drinks, if they take cold water bath, or sit under fan, or washing face, all these things work as if they are pouring cold water over the hot glass. So we are seeing on such things, one, soon after coming from outside, if they sit under the fan or take cold water bath, we have seen many patients have developed a fever, and that fever get cleared with Antim crude. If you read Antim crude, either in Murphy or Clark, he says, ailment from taking cold water head bath after coming from outside. On that basis, we are seeing such things when this is the cause for their ailment. We have seen Antim crude has helped them. Even washing face soon after coming from outside, or taking ice cream after going out in hot sun. So in such cases where there is severe throat pain, that throat pain could be corrected with bellies, or effect of washing face from outside, coming from outside, also could be corrected with bellies. The other thing, the advice to the patient is, tell them not to take cold water bath. It is usual comprehension that by taking cold water bath, they feel better during summer. They can take and they think nothing will happen. But on the contrary, when they take cold water bath, the temperature of the body comes down and they feel comfort during bath. Once the bathing is over, the body tries to maintain the temperature and works faster, which brings more discomfort in the body after taking cold water bath. So it is always advisable to take lukewarm water, not complete cold water. And even parents think that they can give ice cream in the afternoon because the temperature is very hot outside and the children don't get affected. Same thing happens here also. There is more temperature outside and very less temperature inside the body, which brings the adverse reaction. That is why they get throat pain, digestive upsets from ice cream taking in the afternoon. So it's always advisable to give the ice cream to the children either in the evening or in the night, even if it is summer. But as much as possible, it is they avoid ice cream in the afternoon. If you read Bellis in Clark, he says taking cold items after getting overheated, that is moving about in hot sun. On that basis, by giving the Bellis in such cases have brought about the improvement. The other medicine that has helped now is also Rumex. Because of the temperature, they move about in AC vehicles and they keep moving out and coming inside. So they move from cold temperature to the warm temperature. Because of that sudden changes, where they move about either in the AC office, they will be working in the AC office, suddenly go outside and come back again into the office. Such changes, and the people who cannot travel in AC vehicles also could be corrected by room X, because if you read the modality of room X and causation of room X, where the complaint is due to the sudden change of temperatures, which in cases of moving about in AC cars, AC vehicles rather, and also working in AC offices. So on that basis, by giving room X, we are seeing their complaints are coming down. And the other advice you can tell them is, whenever they feel very tired, let them take slow inhalation from the nose and exhale forcefully through the mouth. So if they do like this, if they do this exercise 2-3 times, that is sufficient. When they feel tired, really you can see the magic, you will get back your strength. The other thing is, of this weather, there are chances of more dehydration, overheat, sunburn, heat exhaustion. So in dehydration, to avoid dehydration, it is always better they take more of liquids, particularly fresh fruit juices, buttermilk, and with the water, if they take very small quantity, about a cashew nut size of jaggery with water or with buttermilk, they definitely they get, and the tiredness of the summer effect will go. You must have observed, even in North Karnataka, where there are very high heat area, the moment you go anybody's house, they will bring a small ball of jaggery and also water. So jaggery with water, not only it's satisfies your thirst, and also it energizes due to the glucose of the jaggery. The other thing you must have observed, in the north where there is more heat, or even in coastal areas where there is more heat, the practice of lassi is more. So lassi, taking lassi also during summer helps you to get rid of the dehydration as well as the tiredness. And you can make use of the more juicy fruits like watermelon, ash melon, orange, sweet lemon, or even lemon juice. So fresh fruit juices will help you to get rid of the tiredness of this summer. One of the patients were asking, on taking watermelon, I get the problem. So how can I take the watermelon? If you read Gingiber in Boric, he says effects of melons. So such side effects of melons could be corrected with gingiber. And we have seen, after giving gingiber, the people who were affected by taking watermelon could be corrected. And also after giving gingiber, there was no effect from the melon. See, even cucumber, tender coconut, these things also will help. And for the sunburn, usually the people who go to the seashore, sea, or they take sea bath, because of the water over the body, and also which is a saltish. And as long as they are in the water, they don't feel the burn. The moment they come outside, we have seen there is a great burning, redness, and also the peeling of the skin. So in such cases, where there is, sometimes when the people go outside, they get the sunburn. The best sun protection or sunscreen is the oil, earnenne, till oil. So let them smear, take a small quantity of till oil and smear either the face as well as the arms, which helps them preventing from sunburn. And you must have observed when they go outside in hot sun, some face will become very red. So in such cases where there was redness of the face, the indium has helped them to get rid of such sunburn. And some patients, their face become black after going in the hot sun. So in such places, we have seen Galanthus, Galanthus. Galanthus has brought about the protection and resistance to easy sunburn. And not only that, for our surprise, we have seen Galanthus has improved the complexion of the skin in some cases. So on that basis, we have tried Galanthus in the sunburn cases where the face has become black, could be corrected with Galanthus. The other thing that we get now as the sun season starts, you must have observed that the housefly, the mosquito, these things have increased. Because of the mosquitoes, we have seen where there is more of chill and fever. In such cases of chill and fever, usually you think of the China horse. But if you study Farrington, the second most, as I remember the second chapter, he says similar families has the similar action. On that we have tried where there was a fever and chill, by keeping half teaspoon of black coffee or coffee decoction on the tongue for about half a minute and swallow it. We have seen within few seconds, their chill and fever has come down and their energy has improved, which we have done once in 2 hours. This is why I am giving you this clue for this, because when you go outside, when you don't find the homeopathy pharmacies, your kitchen is the best pharmacy, where you will find many raw materials, where you can convert that raw material into potency and give them. And we have seen it has come down. And even where there was a vomiting, because of the vomiting, severe vomiting, we have seen Ipecac has indicated, where Ipecac has indicated, we could give coffee decoction, because coffee decoction and the Ipecac both belongs to the natural order Rubiaceae. On that basis, by dissolving 1 drop of coffee decoction in ½ liter of water, shaking well for half a minute, and start giving 1 sip every 10 minutes, we have seen the result within an hour. Same way when the Ipecac was not working and where there was a great burning. In such cases where the iris versicolor was indicated, we have used the saffron petals, that is Crocus sativa, which are both are similar, and even many times the Crocus sativa has helped in appendicitis pain, and also severe blackish discharge, menstrual discharges, which I could correct it when I was on a tour where I could not get the homeo pharmacy in Western outside India. I could get the result by dissolving saffron petals and 1 drop of that water in half liter of water and shake it well and start using. So in such severe cases, we have seen these things also have helped. And due to the severe chill and fever, either due to fever or due to urinary tract infection also, we could use the coffee decoction as check. We could use saffron petal as Iris versicularis, in some cases where the eyes were affected because the moment they come from out their face, because of that, they're similar to the as some cases could see even bacterial conjunctivitis where there was a agglutination of eyes, and also in some cases there was complete redness with engorged blood vessels, the sclera, where the whole sclera was looking bloodshot. Where there was viral conjunctivitis, where there was more of watery and irritation in the eyes, we could get the result from euphrasia. And where there was a bacterial conjunctivitis, where was the agglutination of it, we could get the result from argentum nitricum, as you all know. And where there was a bloodshot eyes with redness, the engorged blood vessels, the whole eye were looking bloodshot, we could get the result Aesculus hippomane. Aesculus has brought down the redness and also prevented such bloodshot eyes from washing face. So usually it is always better to advise the patient not to wash their face from outside because they feel like pouring water over the face. So for such patients, you can even drinking tender coconut or taking juice or taking ice cream, they can stand in a shelter for about few minutes where their body temperature will come down, and then they can do washing face or sitting under the fan or drinking juice and ice cream. Such things they can do when their body become cold. The other thing is that we get during summer is the headache, severe headache. Particularly when they move about in hot sun, when they get the headache in the temples. Many times we have prescribed medicine on the basis of location of the headache, where we have not taken much details, but mainly on the location of the headache, on prescribing the medicine, we have got the result. That is, we have seen when the and not only that, of late, the children are getting more headache because, as they said, school headache, not because of the school or studying, because they are not giving much time to eat with a relaxed mood. The 10 minutes short break and 20 minutes long break. Whereas when we were at the school, we used to come home, eat, relax, and then go. We had so much time. Now the children are not giving much time, so that what they eat will be very little, and when they eat in a hurry will not be assimilated properly. And because many times they have to eat with tension because the homework is not done or the other class start. When they eat with such tensions, their headache increases. So we have seen in such cases, natrum mure has helped when there was headache in the temple. After moving about, if they get the headache in the vertex, where they feel better by pressing by hand or by covering, get corrected with cactus. When the headache was at the parietals, we have seen we could get the result by using kali iode. When there is the headache in the upper occiput, the carbovage will help. When the headache at the base of the neck, base of the head, or in the nape or in the lower occiput, the cicuta virosa could get the result. With when the headache starts on the forehead and goes back to the defloratum could be corrected, where invariably we have seen when the headache is with the constipation. So lac defloratum definitely has helped the patients. And when the headache with eyeball pain, we have seen the body aga has helped in clearing their headache after coming from outside. And whatever the medicines now I am suggesting, it doesn't mean that they are the only medicine that helps. If you find any particular symptoms, if you notice, which is more prominent and more outstanding, in any of the drugs, if you find those symptoms, you can prescribe irrespective of any complaint or any diagnosis. Whereas the diagnosis is useful for the sake of management of the case. But for the selection of the medicine, we need the symptoms and we don't depend much on the diagnosis, that is the name of the medicine, name of the condition. The other thing, when we come from outside, when because of these effects, if there is a fever, usual fever that happens, as I told you, when they come out from when they come from outside and take bath, because of that sudden cold effect, we have seen antim crude has helped in clearing the fever. But in majority of the conditions now, what we are seeing is when they get the fever, they get the burning in eyes. We have seen many times the moment the patient entering our chamber, they keep blinking and come inside. And when we ask, is there any burning in eyes? They say yes. And in such cases, we have seen CPA has improved the condition. And not only that, the main indication for CPA in such fever is, as the temperature increases, their burning in eyes increases. Whereas you will find same burning in palms and soles in case of sulfur. So we have seen along with sulfur, even aconite has helped as an acute remedy with sulfur to bring down the temperature.
Excuse me, sir.
The other thing,
Sorry to disturb you, sir.
Yes, please.
We have
Yes,
only
please.
1 minute left, sir, for
No
completion.
problem. I am finishing almost.
Yes, sir. We have 1 minute. After 1 minute, it will get closed by itself, sir.
Okay, sure.
Okay, sir.
Sure.
So whatever is left out, we can keep it for one more session, sir.
Sure,
Shall we
sure.
continue that, sir?
Sure, even
I'm
that will
really
do.
sorry for that, sir, because we started earlier.
No, not at all. Not for me.
Okay, sir. Fine,
So
sir.
we'll keep in another session. No problem.
Fine. Fine,
And
sir.
I thank you everyone and wishing you all once again a happy Shivratri.
Thank you, sir. Thank you very much for your kind
I hope
information.
it was informative.
Yes, sir. Definitely, sir. I'm really sorry to all the participants. We request you to join in one more session, which we'll be doing it very shortly because of the lack of time. We're closing the session for today. I thank all the office bearers of KHMA, our president, Dr. Virbrahmachari sir, our working president, Dr. Rajesh A. sir, and our General Secretary, Dr. Niranjan sir, for your kind cooperation in conducting today's session. And finally, thank Dr. Madan sir once again